The Adams County Health Department says they have confirmed a case of tuberculosis involving a detainee in the ICE detention facility in Aurora. The department says its effort to determine if its spread is hitting a major roadblock.
Public health leaders say that ICE is blocking their access to investigate just how far the tuberculosis has spread. 9 News reporter Rachel Krause joins us now from that facility. And Rachel, there's a protocol to track TB to contain outbreaks, and it apparently is not happening as it normally does in this case.
Yeah, under state law, public health officials are required to investigate, and that means talking to the patient, accessing medical records, as well as talking to people who've been exposed in the facility for contact tracing. Adams County says they've requested to do it, but the facility that's operated by the GEO Group hasn't allowed it. Now, the health department says they issued a public health order nearly 3 weeks ago to require GEO let them investigate. Denver Health, the primary TB care provider for the area, says they haven't been allowed to communicate with staff either or see who might have been exposed. TB can be serious and at times deadly. It kills more than 1 million people worldwide every year, most outside of the U.S. It's an infection that most often impacts the lungs. You can have active TB or you have active disease and symptoms like pneumonia, coughing, and shortness of breath. Some have inactive or latent tuberculosis, where your body has controlled it but hasn't gotten rid of the infection. You cannot spread TB if it's latent, but it can reactivate to active tuberculosis later on in life, usually when your immune system takes a hit. Dr. Jay Finnegan, a pulmonologist at National Jewish Health, says treating TB takes multiple drugs given diligently, often for months at a time. He says there are strict protocols that need to be followed after an active TB test to prevent the spread.
Well, I think the real concerning thing is if there's not proper control for tuberculosis. Quite honestly, you could argue you want fewer people let in to see what's going on. Obviously, you want the appropriate people to be aware of what's happening and controlling it. In general, you can control these things as long as you take the proper steps. And so I think that's what's the most important thing.
I reached out to the GEO Group, who sent us to an ICE spokesperson who said in a statement, as of today, Aurora does not have any confirmed active tuberculosis cases. That spokesperson also says that ICE is complying with state and federal guidelines. Reporting live in Aurora, Rachel Krause, 9 News.